to everybody. Thank you so much for being here. My name is Carrie Wimberly. I'm the Executive Director of the Addiction Prevention Coalition. And we're so happy to be here again. We're in a series called Why Won't They Stop? A Family Support Series. And we started in January. We've been doing one almost every month. Really helpful topics. Conversation has been fantastic on here. You guys have given us lots of ideas of things that you're interested in and would be helpful. And we're planning future webinars around that. And I wanted to, first of all, just thank all the different organizations that are part of this series. UAB, both UAB Addiction Recovery and UAB Beacon, Not One More, Alabama and Huntsville, Thrive Birmingham, the Birmingham Recovery Center, who's hosting our event tonight, the Drug Education Council of Mobile, and this project has been funded by the Children's Trust Fund of Alabama. So grateful for all of these organizations and the great work that they do, and for partnering with us on this series. Tonight, we're talking about topics and techniques for family discussion, which is such an important topic. I know just based on our family having two sons that struggled significantly, I wish I had had more education, especially early on. Just didn't know how to handle this type of situation, did not know how to have those conversations, and having to relearn that as a parent. I know in our family support group, this is a lot about what we talk about week in and week out, is really trying to learn how to do this well. So we're excited about this topic. So I'm going to turn it over to these guys. I want to introduce you to Ian Henyon. He's the Executive Director of the Birmingham Recovery Center. And then also we have Colin and John, and they are, it's Managing Director and something about business development.
Director of Business Development.
Okay, I was close.
So. Yeah, you did great.
And I want you guys to introduce yourself fully, tell everybody a little bit about your background. And I would love for you to talk a little bit about Birmingham Recovery Center and educate us. I know you guys just had your 1-year anniversary, which is, I can't believe it's been a year. That's exciting. And truly, these guys have changed the landscape of outpatient services in Birmingham, and we're so thrilled to have them here. They're a real partner with us and have been so gracious to say yes to almost everything I call Colin about, and that is amazing. So we are so appreciative of all that you do for us and for so many. So I'm gonna turn my camera off. I'm gonna turn it over to you guys. Tell us about yourself, and then we can get started.
Colin, John, why don't you kick things off?
All right. Yeah. You want to go ahead? Sure. So I'm John Gianetto. I'm the Director of Business Development at Birmingham Recovery Center. Like Carrie just said, we opened up a year ago. A little bit about me. I'm somebody who's in long-term recovery, originally from Boston, Massachusetts, and then got sober myself in Atlanta, Georgia, almost 8 years ago on September 5th. And then moved to Birmingham about a year ago. So just worked in the industry for the past 10 years, different kinds of roles, from overnight tech to admissions, business development, where in the business development, pretty fortunate, I get to travel around the country, tour some other facilities where people would be good for us to work with, meet with local therapists, psychiatrists locally in Birmingham as well. So at Birmingham Recovery Center, I get to meet these people, then also help out on our front end with our admissions team and kind of smooth the process and make it really as easy as possible for somebody to access treatment at our facility.
I'm Colin Harris. I'm the Managing Director of Birmingham Recovery Center. A little bit about my story. I'm a heroin addict. Started trying to get clean and sober in Alabama about maybe about 15 years ago. Went to a couple programs in Alabama, and that was it was unsuccessful, and I eventually went out of state and ended up in a facility in right outside of Atlanta, Georgia, which was where I got sober. I
You
yeah,
met me.
and met John there at one of the first places that I went over there. I met John, and we became very good friends. And I uh, I stayed in Atlanta for a while. I always wanted to come back to Birmingham. I love Birmingham. I love Alabama. I'm from Montgomery originally, but lived in Birmingham for a few years before going to Atlanta. I kind of always thought that there needed to be some more options in Alabama. Everywhere else I went, there was a whole bunch of options, but we didn't have a whole lot in Alabama. And started thinking along those lines and reconnected with John, and we got to talking and came up with a plan and kind of got that down the road a little bit. And then we reached out to Ian, who was in Atlanta as well, and kind of put it in front of him, and he jumped on very quickly, and we kind of took off from there. And it was just over about a year and a month ago that we opened Birmingham Recovery Center, and it's been our thing has been about providing really good quality care, and making it accessible to patients. And I'd say we've been very successful in that. And it's been a lot of fun. It's been fun watching people come into our program, do really well, get through the things that they're struggling with, and watch them come out the other side of that has been incredibly rewarding. Grateful to be here. We're big fans of Addiction Prevention Coalition and all that they do. And we're grateful that we're invited to speak to y'all tonight. Ian, I'll let you take it.
Cool. Thanks a lot, guys. And thank you, Carrie. Excited to be with everybody this evening. I'm going to go ahead and share my screen and start the presentation. I have a whole slide about myself, so want to make sure we get to that. If y'all have questions as I go along, please go ahead and put them in the chat. Carrie will be monitoring the chat, and if Carrie, please feel free to chime in if I need to clarify anything. I do want to say I saw a fair number of professionals in the participants section, and I think it's important to say that this presentation is really oriented towards the lay person and towards families that really need some more information about how to address this situation. It really is a complex problem. And I do want to say that I'm going to be covering a lot of ground this evening, and the information that's going to be presented is normally best addressed in a semester-long graduate level course. And so I'm going to be talking in a lot of generalities, but please know that we treat individuals. And as we drill down to the individual level, a lot of those generalities might not apply. So I would just encourage you, if something doesn't necessarily apply to you or your family, just hang in there, and a lot of the information will apply to you. All right, there we go. Presentation is a little slow. So what are we going to be doing this evening? I think it's really important that we define what the different types of substance use that we see, define what those are, because that's really going to inform how we respond on an individual level. We're going to look at a variety of different substances, in particular substances that we see at Birmingham Recovery Center most often. We're going to spend quite a bit of time talking about how to respond when there is substance use within the family. And then at the end, we will have additional questions and time for some more discussion with Colin and John. So as promised, this is who I am. Just more information about my education. I do have a master's degree in counseling with a subspecialty in addiction counseling. I am a licensed professional counselor, which means in the state of Alabama, I am able to treat people via psychotherapy services. I've been in the addiction field in some form or fashion since 2008. And I got into the addiction field. This is my second career because I am also a person in long-term recovery. And what that means, again, for the lay person is that I don't drink alcohol anymore. And I don't take any substances that aren't prescribed by a doctor. So for me, that's what long-term recovery means. So as I mentioned, we want to look at substance use, and we can really conceptualize this on a spectrum, with the least severe being on this left-hand side and starting out with experimentation and moving up to social and recreational use. As it gets more severe, we're looking at habituation, high-risk use, and eventually we get to addiction, which is the most severe type of substance use. And again, what's important about this spectrum is that we really want to understand better where the individual is with their substance use. That really informs how we respond, and the response to this needs to be appropriate. For example, if you sprained your ankle, you wouldn't go to an orthopedic surgeon. So we want to make sure that the response is appropriate to the condition. At the same time, if you needed an orthopedic surgeon, you don't want to go to an urgent care center for treatment. So like to couch things in terms of medical examples. I think people tend to understand those a little bit better. So in looking at some of these areas of use, starting with experimentation, this is really when someone is curious about the effects of a particular substance, and this might include young people trying alcohol or marijuana for the first time. And I think it goes without saying that a lot of times this is influenced by peers. Now, we might not consider experimentation to be very severe. I will tell you that substance use for minors, there is no level of substance use for minors that is safe or acceptable. And at the same time, an adult that might be experimenting with, say, marijuana for the first time is one thing. If someone is experimenting with heroin, the response is going to be considerably different. Next, we move to social and recreational substance use. This is the most common area of use that we see, and this is where someone might be drinking alcohol at dinner, or having drinks with friends at a club, having beers at the tailgate at football games. And so it tends to be irregular, it tends to be occasional. There aren't a lot of consequences associated with this use because it is so occasional, but oftentimes this recreational use, the individual is seeking out a particular substance and a way to feel differently. So a lot of people know if they smoke a joint at a concert, they're going to feel a certain way. So the next level, and this starts to get more severe, is when it becomes habitual. And this is where there is definitely a pattern to using. And so this might be where someone is going to a bar every single night after work, or drinking heavily every Friday night and into the weekend. And this is where we also start to see consequences to the using. Although the consequences don't tend to be as severe, we will see consequences like people being late for work because they stayed out too late, or being hungover and not being able to go to work. We might see consequences like younger people struggling to complete work and school, and those types of consequences. Next, we have high-risk use. This is where someone continues to use substances knowing that the consequences have gotten pretty severe. So this is where someone might continue to use alcohol after getting a DUI. Or they might continue to use heroin or other opiates after a overdose and ending up in the hospital. We also would consider high-risk use if anyone has a medical condition that is exacerbated by alcohol use, or even a mental health issue that is made worse by, say, marijuana. That would be considered high-risk use. And then the most severe area we call addiction. I think everyone is familiar with that term, but it's really important that you have a little bit deeper understanding of precisely what addiction is. Now, I promise that I'm not going to read off of every single slide verbatim, but I think it's important that I do read this definition to you. Addiction is defined as a chronic relapsing disorder characterized by compulsive drug seeking and use, despite adverse consequences. It is considered a brain disorder because it involves functional changes to brain circuits involved in reward, stress, and self-control. These changes may last a long time after a person has stopped taking drugs. Now, if you take one thing away from this presentation this evening, I'd really like it to be that your understanding of addiction is that it is a disorder of the brain. And if you look at the title of this series, which is Why Won't They Stop Using? They won't stop using because their brains are not functioning properly when it comes to addictive use. And I want you to consider a mentally ill person who does irrational things, and that makes sense to a lot of people. Same holds true with addiction. Addicted people will do irrational things and things that don't make a lot of sense. Again, because addiction actually changes the way the brain functions. And it's really important that we view addiction in those terms. So in terms of actual addictive use, this is what it looks like. There is compulsive substance use. It's really an irresistible urge to use. And a lot of times we will ask our clients, and you might even ask your loved ones, well, why did you use knowing that it's really causing you all these problems? And a lot of times they might say, I really don't know. I mean, of course they use because they like the way it feels, but at the same time, there is a confusion about why they continue to use under these circumstances. It's because it is compulsive. Oftentimes, the addicted person is going to use larger amounts or for longer periods. And so this might include somebody who says, I'm only going to go out and have 2 drinks tonight, and they end up getting really drunk to the point where they can't drive home or they can't go to work. Oftentimes there is an unsuccessful attempt to cut down or limit their use. So again, using alcohol as the example, somebody might say, well, I'm not going to drink liquor anymore. I'm just going to drink beer. And of course, they end up drinking more beer than they intended. Or I'm only going to use cocaine on the weekends. That might be recreational use, but they're not able to control that, and they end up using cocaine throughout the week. The addicted person often spends a lot of time related to using. So again, this might be a person, you go to the bar and you drink and you're there for several hours. There is time involved in actually being intoxicated. And then of course, time involved being hungover. And we can see that in other substances as well. Addicted people often give up activities that are important to them. And this cuts across all areas of their life. So work, for younger people, school might have been a priority, but they just can't succeed in a school environment because they are using more often. We see family obligations, social activities, all those tend to go by the wayside. Again, mainly because a person is using too frequently. Of course, they continue to use despite knowing that it's causing problems. Oftentimes, people will use at the beginning of the day. So this is again the person that's drinking to start their day. A lot of people will use marijuana to start the day off, or if someone is using opiates, they're going to need to continue to use that substance, so really that they can function. This is an important one too. So oftentimes the addicted person is really going to have really be defended around their need to use. And this is where we might call this the justification, but they're going to be saying things like, I work hard and I deserve to be able to let my hair down and drink and relax. I deserve to be able to smoke pot all the time because, you know, hey, I do go to work and or I'm doing well enough in school and I should be able to do these things. People that aren't using addictively can, as far as substances go, they can just take it or leave it. But we find that people are really defended around using when it gets into these higher levels. A lot of times people are going to experience withdrawal symptoms. And of course, this involves alcohol, opiates, cocaine withdrawal. A person will stay up for days at a time, and then they might need to sleep for a day or two in order to deal with that. An addicted person is going to need to use increased amounts in order to achieve the effect that they want. And this is often referred to as tolerance. And certain drugs, again, particularly opiates, the body develops a tolerance where you have to use more and more. When it comes to alcohol and marijuana and some other substances, your tolerance is just one of needing to feel the way you want to feel and needing more to be able to do that. All right, so back to this spectrum of substance use. And again, we've got the more severe instances of use along the top here. And by the way, Birmingham Recovery Center, all of our clients will fall into these two areas, the high risk and the addiction areas. Every once in a while, we might get somebody who looks like they're still just using habitually. That's rare for them to be at our program, but most of the time they're here in the high risk and addiction. Now, these areas will also include what we call substance use disorders. So this is a clinical term that is applied to a person that is experiencing problems related to substance use. So if someone were to go to the hospital because they've consumed too much alcohol, they're going to be discharged with an alcohol use disorder as a diagnosis. But I want to provide some context here, because not all substance use becomes a substance use disorder. There is a large study that is done by the US government. It's done every year. It encompasses usually about 70,000 people, and they survey people that are 12 and older. And 2020 is the year that we have the most recent data for. So according to this study, 50% of all people in this group used alcohol at least one time during 2020. They may have used more, but if you drank alcohol once, you were included in this number. So about 50%, 138 million people. About 13.5% used drugs. And just so you understand, in terms of what we're talking about as far as illicit drugs, that would include marijuana, misuse of prescription medication, and we're going to drill down a little bit deeper, and we're going to talk more about prescription drug misuse. But there's also cocaine, hallucinogens, meth, inhalants, and heroin. Now, for some people, they might be using alcohol and drugs. So these people certainly could be counted twice, but in terms of this study, they differentiated between at least using alcohol one time or using drugs one time. So in terms of substance use disorders, we have 50% of people that use alcohol, but that number goes to 10% that meet the criteria for an alcohol use disorder. And then when we look at drug use, 6.6%, again, meet the criteria for a drug use disorder. And I think it's interesting to note that as far as alcohol use, about 20% of people that use alcohol end up having an alcohol use disorder, again, according to this data. But if you look at drug use, almost 50% of people that use drugs at least once also meet the criteria for a substance use disorder, which of course is more severe than just using occasionally. That is the study. I like to cite that so you guys know I'm not just making these things up. All right, substances that result in substance use disorders. What are the most of the substances that we see? And again, according to this study, we already had this number, 28.3 million people have an alcohol use disorder. The next highest category would be marijuana use disorder. Now, in terms of treatment, we don't tend to see a lot of people that are there strictly for marijuana use disorder. What we do see is people that have a co-occurring mental health issue that's being exacerbated by that marijuana use. So people that are bipolar or have some kind of psychotic disorder, using marijuana is a really, really bad idea. And if there is a predisposition to mental illness, marijuana and cannabis products are a good way to get pushed into psychosis. So it's really not safe for a lot of people. Next category is prescription pain relievers. Now that would include, and again, we're going to talk more about prescription drug use, but this includes a lot of the things that we're seeing in the news these days, particularly fentanyl, but also some of the more common ones, Vicodin, Percocet, that type of thing. And then the next substances, meth, cocaine, prescription stimulants, and heroin. Now, if we combine heroin with the prescription pain relievers, these are both opiates. So we're looking at about 3 million people that would have an opioid use disorder. And then if we look at this middle category, we can really combine all three of those, meth, cocaine, and prescription stimulants. These are all stimulating substances, and about 3 million people have that stimulant use disorder. And I would suspect a lot of these people are using all of these substances, maybe not together, but they are users of these particular substances. All right, let's look at prescription drug misuse. Now, before I get too deep into this, I do want everyone to understand, if you are prescribed any of these classes of medications, there are important and legitimate medical uses. And I'm not picking on these substances. These are substances that can be misused. If you are prescribed them, that is perfectly fine. But just want to highlight some of the problems that can occur. So for prescription opioids, those are, of course, are prescribed for acute and chronic pain. And those are some of the common ones that we see that I had mentioned earlier. Next would be prescription stimulants. These are commonly prescribed for ADHD. And ADHD is a debilitating condition. And a lot of people need prescription stimulants in order to function, and they function very well. Some of those more common ones, Ritalin, Adderall, and Vyvanse. Commonly, we see college students or high school age students misusing these medications. They can use them to stay up late and study, and then not have to sleep, and then take some more the next day and go take their test. So it's a common problem, certainly at the collegiate level. And then prescription sedatives. These are commonly prescribed for anxiety, panic attacks, and sleep. And some of the more common ones we see are Xanax, Klonopin, and Ambien. All right. Going to ask a question, and I'm sure a lot of the professionals might know this, but I'm wondering if anyone can tell me what the #1 source for obtaining prescription pain medication when it's misused. If anyone knows where most people get those. Well, I'll just go ahead and tell you. Oops. Try this one more time. The #1 source for prescription pain medication that is misused comes from relatives and friends. And a lot of times this is your home. So this is where most people get these. The next largest category is from healthcare providers, so from doctors. A very small percentage, 6.2%, comes from a traditional dealer. And then we've got this other category that's probably the internet or something along those lines. So a lot of times we focus, or we think we need to focus on, hey, people are getting these from dealers. No, most of the time they are coming from either your home or from a healthcare provider, or the home of a friend or a relative. And so if you are prescribed these medications, or you have some of these medications in your home, it's really important that you keep this medication secure. And this would include the other prescription medications that can be misused. I would not keep these in your medicine cabinet. If you could, it's best that they are kept in a lockbox, but at the very least, they should probably put in a drawer. They should be put away somewhere where medication isn't normally kept. I can tell you that if you have these medications in your home, and there are people that have access to your home, so that being a housekeeper or a contractor or movers, they will steal this medication. So it is important to keep that secure. It will also keep it out of the hands of people that will, so people in the family that might take it as well. It would be really helpful, particularly if you have, if someone is prescribed pain medication, that someone else dispenses each dose. Now, that may not be practical, but if you can limit the amount that someone has access to, it's just, it reduces the chance that someone is going to take more than they are prescribed. Really important that you dispose of any of this unused medication. You don't want to, again, keep this stuff sitting around. It's not something where it's like, oh, what if I hurt myself again and I might need it? You do want to dispose of the medication. It can be taken back to pharmacies will take this back. There are prescription take back programs that occur in municipalities on an ongoing basis. A lot of times you can take them to police stations. At this point, you're not supposed to flush them down the toilet. If you do want to throw them out, if there is a way that you can really dispose of them in terms of making them unusable, you want to try to do that before you just put them in the garbage.
Ian, this is Carrie.
Yes.
We also have doTERRA bags available. They're free, and those, to get rid of medication. So if anybody wants one or multiple of those, we can mail those to them. They can just reach out to us.
Can you say more about what that bag is?
Okay, it's a doTERRA bag. It's a little it's kind of plastic, and you basically put the medication in there, and then you add some water to it and shake it up a little bit, reseal it, and drop it in the trash. So it breaks down the medication, so that if you want to clean out your cabinets, every time we go and table anywhere, we give out doTERRA bags and instructions on using those.
Thanks, Carrie. Yeah, so that's a good example of really how important it is to dispose of medication if there's a product like that available. Lastly, be aware of family and friends that might have conditions where pain medication is prescribed. So, a lot of older people, unfortunately, if they have cancer, make sure that if they are in your family, that you're asking them to secure that medication. So when you have people over, that no one is taking those. If anyone has had a serious medical procedure or surgery, somebody that and they might have young adult or teenage children, you just want to be aware that that now those substances could be available to them. All right, a few statistics I want to share with you. A third of teens believe that it's okay to use prescription drugs that are not prescribed to them. So a full third. And 25% of teens believe that there is a minimal risk to using prescription painkillers without a prescription. And that is at the bottom is where I got those statistics. Now, 27% of teens believe that using prescription drugs to get high is actually safer than using street drugs. And 16% of their parents believe the same thing. Now, from an addiction perspective, using prescription drugs that are not prescribed is not safe. It is not safe to use these substances to get high. We're also seeing a new problem. These are headlines that I pulled off just from the past month. And so it's getting fairly common that people are able to obtain the substances to press their own pills. And what they're doing is they're making these pills and they look like pharmaceutical grade substances. So again, people think that they are safe. I mean, they're from a pharmacy, they're prescribed by doctors. Why wouldn't they be safe? Well, a lot of these pressed medications are now containing fentanyl, and people are taking these pills and they are overdosing and they are dying, and it is horrible. So from a variety of perspectives, taking medication that is not prescribed to you is really not a safe situation. All right, one other area of substances I want to take a look at, we call them gas station drugs, and we call them gas station drugs because that's where people buy them and that's where they are sold. It's a lot of gas stations, believe it or not. One of these substances called kratom. This is an opioid analog, so the high that you get from it is similar to taking an opiate. Kratom is a plant. It is grown primarily in Southeast Asia, and the leaves are dried and pulverized, and they're put into capsules mainly. Some people brew tea with them and things like that. But this is a very addictive substance, and I have treated people that this is their primary drug. And my understanding is the withdrawal from kratom is pretty rough. Now, kratom is illegal in Alabama, but all the surrounding states it is not. And kratom is marketed as an herbal supplement. And it is, again, from a recreational use might be fine, but really it is, it can cause some significant problems when it gets into the addictive area. It's another substance called Tiana. This was a huge problem in Alabama until last year. It is still a problem, but it is now illegal in Alabama. It is also an opioid analog. It comes in capsules, but this is the biggest brand. This is what these bottles look like. These are also sold as herbal supplements, so it's pretty unbelievable that they can package this in this way. Uh-oh, got a cat. This substance, as I said, is now illegal in Alabama. It is still available in Mississippi. So if for some reason you have a family member that seems to be going to Mississippi a lot, you might want to have a talk with them. All right, lastly is a substance called Delta-8. Delta-8 is just cannabis. It's pot. It is a type of cannabis. And where we see it mostly is in these vape cartridges. And so, of course, vaping is very popular with young adults and even minors these days. And you can go to a vape store and buy these Delta-8 cartridges. They're also, one of the popular formats is in gummies. So these look real nice and appealing, but this is an intoxicating substance. People say that from a strength perspective, that Delta-8 is not as strong as regular marijuana, but I'm told that this stuff really packs a punch. So if you see these types of products in your home, someone is getting high. And this is legal in Alabama. In fact, it's legal in a number of places. And so we're seeing people use this pretty frequently. What I'll also tell you is if you are subject to a urine drug screen for your place of employment and you use a Delta-8 product, you will test positive for marijuana. You will fail that drug screen. So this is not a safe alternative to marijuana.
Ian,
Yes.
Denise is asking about marigold seeds. You know anything about marigold seeds?
I don't know anything about marigold seeds. If anyone else does, I'd say chime in. What I will tell you is that um, it seems like every few years there's kind of a new substance that we learn about that people are misusing. So I wouldn't be surprised if somebody was using those as a way to get high, but I'm not familiar with it.
I'm not familiar with marigold seeds
I'm not either.
Neither is John.
Hallucinogen.
And you guys should know.
Yeah, yeah, yeah.
It's my job to know.
Yeah, but it's something that we'll look into.
All right. So what can be done in response to substance use? I want to talk a little bit about the various levels of care that are available. And we're going to talk more specifically about these, but the two top ones, detox and residential, these are inpatient levels of care. Basically what that means is the individual is living at the facility, staying at the facility and receiving care. The three on the bottom are outpatient, where they are receiving services and generally living at home. Sober living is a little bit different. I'm going to talk about that in a second, but just for comparison purposes, just think in terms of a medical procedure that you might be able to have done on an outpatient basis. You go to the facility, you get it done, you come home, as opposed to a procedure where you need to be in a hospital and have 24-hour care.
And Ian, I would like to add just real quick, with like the detox for anybody who's, if you or your loved ones using benzos or alcohol, and benzos can be Xanax or Klonopin, I would always recommend the detox as well as the opiates, just because, you could go into a seizure and, even die from the withdrawal symptoms of alcohol and benzos.
Yeah, thanks for saying that. So detox is really a medical stabilization, because abrupt cessation of alcohol or the benzodiazepines can result in death. And so our clients that come to us and have recent use of those substances, it's something that we really insist that they have the medical detox done, because it is much safer. Now, opiates, you are not going to die from opiate withdrawal. My understanding is that you feel bad enough that you would like to die, but
We can confirm.
Yeah, we can confirm that.
all right.
Yeah.
Thank you very much. The reason that you might go to a detox or engage in a detox related to opiates is because the withdrawal is so uncomfortable. It's really tough to do the treatment that you need to do when you are experiencing that level of withdrawal. And so they can start you on medications and really get a solid foundation for moving ahead in treatment. A medical detox generally is going to be 3 to 7 days. It really just depends upon the person and the substance that they're using. So the next level of care down would be a residential treatment. Now, this would be indicated for a person that might have some mental health co-occurring issues that need to be stabilized. So depression, anxiety, bipolar, again, that's exacerbated by the substance use. You really want to get your arms around those conditions so that someone can move ahead with treatment, or someone that's at high risk for using, if they can't be at home, and if there's a high likelihood that they are just going to keep using at home, then a residential treatment would be recommended. And as far as the length of stay, It's generally 21 to 45 days, again, depending upon the person and the substance that they are using.
Ian, there's a question, which is a good one, and it says, so detox is considered treatment? And I think, that's really a good question, because
Yes.
lots of times people will say, I'll go to detox, but I won't go, after. So can you talk a little bit about that?
Yes, it's a great question, and we see that all the time. So again, detox is really a medical process. There is some level of psychotherapy that might go on in a detox facility, but really you're just being monitored by medical staff to make sure that you are safe to come off of these substances. Now, for some people, that might be sufficient. But you probably didn't get to the level where you're needing detox, to where needing some kind of additional treatment after that is something that you really might need. And so we get a lot of clients into our program who will say, yeah, I've been to detox a couple of times, but I've never done anything after that. And oftentimes it's just not successful. So moving on down to PHP and IOP. Now, these are acronyms that probably don't mean a lot to the layperson, and that's okay. PHP and IOP just refers to the number of hours of treatment that have to be provided in a given day. And just for everybody's information, the services that we provide at Birmingham Recovery Center are at the PHP and IOP level of care. Now, the indicated person would be at a more elevated risk for relapse, and really just need ongoing care in order to support their recovery. And for some people, they're not able to engage in a say residential treatment. So at the PHP level of care, they could continue work or school or engage in the family activities that they need to participate in. Now, length of stay in that level of care tends to be about 2 to 3 months.
And then real quick, Ian, and a lot of people, they do go and they'll start at detox and go there for 3 to 7 days and then transition into a residential program for that 21 to 45, like Ian stated, and then step down once more to that PHP IOP level of care, which can really benefit people because it can learn how to balance their recovery with their everyday life, like work and school, and kind of learn how to deal with, living life on life's terms, and learn how to deal with life's triggers, but also have the support of the clinical and medical team at their PHP and IOP program.
Yeah, good point. Again, just for everyone's information, I would say 50% of our clients start at this inpatient level of care, either detox and or residential, and come to us to continue their treatment. And the other 50% admit directly to our program. And these programs aren't necessarily, or these levels of care aren't necessarily linear. They don't have to be linear. And so we do have a lot of folks that will go to detox and then come directly to us. And sometimes someone will come to our program and it's just not a sufficient level of care for them. And we're actually increasing their level of care and referring them to a residential program. So sometimes it is a straight up and down, and sometimes there are other options as well.
Ian, I think that's a great point. Just from my perspective as a family member, I know initially there was it was such a fear of, we have to figure out what's got to happen and it's got to be exactly right, or it's not going to work. So just what you mentioned, okay, recommended maybe, PHP or IOP. But then once they get there, you're like, okay, you need more care. So let's help you find the right place. So I guess to decrease the anxiety of the family member, if you have a loved one that says, I'm ready to go, work with the professionals, but trust the people that you're working with to help you get to the next right place and not worry about it being just exactly right.
That's right.
That's also
Thank you.
at Birmingham Recovery Center, we do offer anyone, treat like a free treatment consultation where they can sit down with myself, Colin, and Ian, and kind of we can learn more about what's going on with that person and what the individual is looking for and what their schedule allows, and kind of make the appropriate recommendation for that specific person, because everyone is different. So I think, most treatment providers should or do provide something like that, because we can only learn so much just over a phone call. So when someone can come in with their family or a loved one and sit down and really open up with us, we can make the best recommendation and kind of hopefully set them on the best path to long-term sobriety.
And that's such an incredibly important service for families, because just from experience, when you're in that space of trying to figure out what to do, especially if it's a child, or a young adult, and you haven't ever encountered this, the information that is thrown at you is so overwhelming. Mm-hmm. So to have people like you that are able to say, hey, come in, and we do this all the time. So, that really relieves a lot of that anxiety for family members.
It can be a very intimidating thing to stand in front of, and it can also be a very complicated world to navigate. There's a whole lot of options out there that Ian's talking about, and where do we start? Where do we go? Who do we talk to? And we love for people to come sit down and meet with us, whether they end up at our facility or not. We want to make sure they get to where they need to be. That's the best fit for them.
Yeah.
And a lot of people hop on Google and they call, the first number that's listed there. And you might be calling, you think you're calling a facility in Alabama, but you're actually in a call center in New Jersey talking about a program that's in California.
Yep.
So it can be really hard to manage that landscape just over by calling people. So if you are ever looking for treatment for a loved one, I'd always recommend, doing as much research as you can. And if you are able to actually go and see the facility before your loved one does admit to that program.
Yep.
Yeah. And I'm going to talk a little bit more about that sort of initial process as well in the next slide, I believe. Real briefly, sober living. Sober living is not a clinical approach. Sober living is a facility, and it is a structured program. It is usually apartment living that just what it says is it is a sober environment. Oftentimes for young adults, this is a really good option. So somebody that's living with mom and dad and things just aren't going well, sober living can be really helpful. Traditional age adults, it works really well for those that really need increased structure or don't have the support that they need to continue in their recovery. But I do want to say it is not a clinical environment. It's not intended to be clinical. It's really intended to support the other clinical stuff that's going on. And so I'd venture to say 20% or so of our clients reside in sober living. And sometimes people come into our program, they're living at home, and it's just not enough support, and we'll make a recommendation for them to go to sober living. And I can tell you, our clients that are in sober living, but they tend to do the best. So it really is a helpful endeavor. One thing I also want to tell you is it is not covered by insurance, so it's something that does need to be paid for out of pocket. The typical stay in a sober living environment, 3 to 12 months. There's a lot of flexibility there. It just depends upon what the individual needs. And of course, kind of the lowest level of clinical intervention would be seeing an outpatient therapist. And this can be where a person starts. So if starting at some of these higher levels of care is concerning, go see a therapist, see if they can get some things squared away, and see if they can get some of the substance using and other issues under control. Or seeing a therapist would be for ongoing support. So all of our clients, as they're completing our program, will be referred to an outpatient therapist for continued care, and you can stay with a therapist indefinitely as long as it's helpful to you. All right, so we touched on this a little bit, where to start when there is a substance use issue in your family. And our recommendation is certainly that you do talk to professionals in your life. So your family doctor, psychiatrist, therapist, even a pastor. So someone that has experience in counseling, they're a good one to talk to. And we touched on this just a moment ago. Talk to a local treatment program. And again, please, if you have questions about a family member and where they might need to seek services, we are happy to sit down with you and to help you kind of guide you with some of this legwork, because again, like Colin said, the information that you're getting, it comes at you like a fire hose. So we can help kind of cut through a lot of that. There are interventionists available. These are individuals that will consult with families and help find the appropriate program and kind of guide families through that process. Interventionists are, they do really good work. They also they tend to be expensive. And so it's something where the family really needs to have some financial resources. One thing that you might want to think about if you are working at some larger companies, they do have employee assistance programs, and these are professional programs, and they will have vetted a lot of the treatment programs, and they'll know which programs accept that company's insurance. And so again, they've already done a lot of legwork, and of course, these are confidential. When you contact your employee assistance program, they're not going to be reporting you to your organization. They are there to help you and your family navigate these issues. So would definitely recommend, if you've got one of these, to talk to them. Talking with friends and family, you know, a lot of times people are ashamed of what has gone on as far as substance use goes. And I can promise you, you are not the first family to experience this. And it's rare that you wouldn't know someone in your immediate support network that has already gone through this with another family member or even themselves. And so reach out to that support network, and they can really give you some objective perspectives on how to proceed. And I think it was either Colin or John that mentioned you really want to be cautious when it comes to the internet. If you Google addiction treatment in Birmingham, the first 3 or 4 that come up are not programs that are in Birmingham, although it will look like they are. And one of these programs has a facility in California. There are good programs in California, but somebody that does this type of marketing, I certainly wouldn't trust to send my loved one. So just be cautious when you're getting information from the internet. Okay.
And
this is our last.
Add something real quick.
Yeah.
Yeah. And then also, if you are looking for treatment for a loved one, always a great resource is, if you do have insurance, is to call the member services number located on the back of your insurance card, and they'll be able to give you a list of in-network providers. So most insurance companies, they do have in-network versus out-of-network benefits. And always, if you go somebody who's in network, they have a contracted rate with your insurance company, and just financially can help you out, versus going to an out-of-network facility as well. So even just call your insurance and kind of find out what your benefits are, if you have in-network versus out-of-network. Are you allowed to go out of state for treatment? There's just a lot of stuff that if you can find that information out before calling facilities, you kind of just better equipped for that phone call.
Yeah, it's a good point. Now, the one thing is that although insurance companies might be helpful in this regard, they also might send you a list of 20 programs that they're in network with. And so again, you're sort of left holding the bag of what, really where do we go from there? And I do want to mention that we can run your insurance and take a look, and we can make recommendations based upon where your insurance is either in network or out of network as well.
Okay, Ian, there's a
Alright.
question from Laura saying, do you not refer to AA in a 12-step program for treatment? So that would be for support, but I'm gonna let you answer that question.
Yeah, and that's a great question. And I thought about having peer support on that slide. I really wanted to focus tonight's talk on more clinical options. Peer support recovery is very important. So AA, Alcoholics Anonymous, Narcotics Anonymous, Smart Recovery, Recovery Dharma, Celebrate Recovery. These are all excellent and important supports for maintaining sobriety. And we recommend to our clients that they engage in these peer support organizations while they are receiving treatment from us. But those are non-professional, non-clinical, and really are intended just for support purposes. So for some people, going to AA is sufficient, and for others, it's not. So that's why I didn't include them. So thank you for that question.
Yeah, and I will say that and just to again emphasize what Ian said, we stress to our clients that we want them to go to some type of support group. And at BRC, we have a number of different meetings we have a CA meeting, a DAA meeting, as well as an HA meeting that all take place at our facility outside of operating hours. I mean, me and John are both 12-step guys, and Ian as well. And, that was a part of our story and our journey. And we encourage all of our clients to not only go to the meetings that are BRC, but any meetings. We liked having them at our facility in a place that our clients were comfortable with, that they could go to. Yeah.
And if you recall, and I'll go back to, oops. All right. If you look at these lengths of stays, it's anywhere from 3 days to 12 months, right? But because addiction is a chronic disorder, we suggest engaging in this peer support recovery for the foreseeable future. You're going to be at our program for maybe 3 months. There needs to be something else in order for you to continue your recovery. That is an important piece. And you can go to those peer support meetings for as long as you'd like. All right, this is the last slide, everybody. And I just wanted to kind of give you all some guidance in terms of addressing substance use with your family member. And the first thing that I want you to remember is people generally don't want to stop using, even though they know it's causing problems. There is a sense that it's really the only thing that they've got that helps them feel better or different. And so don't be surprised when you speak to your family member and they're resistant to wanting to stop using. And so it's important that you don't necessarily focus on the substance use, because again, this is the area where they're going to be most defended. And so if you want to talk to them about, hey, I'm concerned that you're struggling in school and you're not maintaining the responsibilities that we established for you. And we think it has something to do with the substance use, but we really need to do something different here. So if you go at somebody just about, listen, you're drinking all the time and you're smoking weed and we're just not going to have it. This is where they're going to be defended, and you're sort of going right at the strength of their defense mechanisms. Before you talk to your family member, have a plan. You kind of want to have your ducks in a row. And again, this doesn't have to be any sort of formalized plan. Just have a sense for what it is that you want to achieve when you speak to them. And of course, for a lot of people, it's like, you know, we'd like you to go to treatment. But sometimes, and this is my next point, if you have a specific goal in mind, you don't want to give a ton of options to a person that's using substances. They're going to figure out a way to find the option that is most palatable. I think it's the best way I can say that at the moment. People generally don't want to do this hard work. And so if you give somebody a bunch of options, they're going to pick the one that's got the least resistance. Again, sometimes if the goal is, yes, we want them in treatment, but there can be a goal that's before that. And a lot of times I'll meet with families without the addicted person. The family will come in and they'll meet with me and they'll say, I don't think my family member is going to want to go to treatment. And I'll say, well, okay, nobody really wants to go to treatment. Do you think they'll come in and talk to me? And they'll say, oh yeah, sure, we can get them to talk to you, and go, okay, perfect. Then let's do that. And so going into these talks with your family with a specific goal in mind will be helpful. You're just going to have a better outcome with that. Keep in mind, this should not be a negotiation. The addicted person is going to want to negotiate. They're going to say something like, well, if you just let me do X, Y, Z, then I will go to treatment, you know, a month from now, or I just need to, you know, finish this semester in school. But depending upon the situation, it just might not be safe to allow that person to continue doing what they're doing. And so just be aware that you don't have to negotiate. You can just be very clear in terms of what your concerns are. And of course, that's my next point. It's important that you are clear about your boundaries. And so for family members, and particularly when this involves a young adult, I have parents say to me all the time, well, listen, I drank and smoked pot when I was their age. And so how can I tell them not to do it? And it's like, well, because it's causing huge problems in their life. And so it really doesn't matter what your history is. Let's look at what's going on with your loved one. And so be very clear. Our expectation is that you are not going to be using these substances, in particular, if we're talking about minors. Again, even experimentation, it is not acceptable as a minor to use substances, period. All right. Now, how we address that is going to be, you know, different than the young adult who is just holed up in their room and using substances all the time. You may want to have other people to support you. So siblings, friends, again, a pastor, trusted peers, having them to support your loved one while you're talking to them about this situation is going to be helpful. That way the heat isn't necessarily on one person. And then lastly, approach this process with patience and understanding. This is not going to be resolved usually the first time you speak to them. It really is a process, and if you can be understanding that they're not going to be thrilled about it, and that they are hurting, then you will feel better if you're able to be more patient, and your loved one is going to appreciate it, and I think respond better as well. So that being said, that is the end of my formal presentation.
And that leads right into the bandwagon that I get on every time we do one of these, and that is, I cannot encourage families enough. Find a group, find a family support group, because education and support is so critical for families. We spend so much of our emotional energy trying to find and get our loved one into treatment and get them help, which is good and right. But a lot of times this is a marathon and not a sprint. And there's so much that you have to unlearn and relearn as you're dealing with these issues, that it's so difficult to do. And because of stigma and because of guilt and shame, you get so isolated. So there's a support group at the Birmingham Recovery Center on Tuesday nights, right?
That's right. Yeah, I realized I neglected to mention, the support group that I facilitate. So yes, Tuesday nights, 6 p.m. Is our family support group, 6 to 7.
Is that open to everybody?
That is open to everyone. You don't have to have a family member at our program, please. And most of the people that do attend that do have family members, but we do have some folks that come and that they're still in the process with their loved one. We're happy to support them in that.
And if you're in and near Birmingham, we have a group in Vestavia behind the Summit. There's a group in Shelby County. UAB Addiction Recovery has a group. Beacon Recovery has a group. There's a craft group in Huntsville. Drug Education Council has a group in Mobile. So there are lots of groups out there, and it's hard. I promise it's hard to walk in the first time, but it won't be hard after that. Because just when people go around and do their introductions, there's just such I don't know, you see people's shoulders drop, like they're like, oh my gosh, I'm in company with people that understand, what I'm going through. And that is valuable. And we need each other. So seek that out. Okay, we've got a few minutes left. So if you guys have any questions, throw them in now that the chat's working. Thanks to help from the Q&A section. They tell me how to fix the chat. So be happy to answer those. But thank y'all so much for doing this, for being a part of this series. It's such an excellent presentation. And I don't know if you're comfortable sending out slides, but people are asking for them.
Sure.
Okay.
Yeah.
So what we'll do is we send out an email after to everybody that has registered for this webinar. We'll include the slides and also a copy of the video once we clean it up just a little bit. So give us a week and feel free to use that. And hopefully within 2 weeks, these will all be posted. The whole series will be posted on our website to view when you're ready. So
I saw
see something.
Laura had a question. What's the
Okay.
website? So the website is www.birminghamrecoverycenter.com. And any information about our family support group would be on our Facebook, and that's Birmingham Recovery Center on Facebook.
Thank you, Colin. All right. Well, there's Bronwyn. Oh, she's saying something sweet.
We like
Thank-
those.
Oh yeah, we'll take those.
Thank y'all so much. We really do appreciate you guys. Thank you for all you do for so many. Thank you to everybody that joined us tonight and through the series. We appreciate you joining us, and please reach out and let us know about other topics. We want to continue these, make them available. This is one of the things we love to do the most, is education and help and support, because it's important for the whole family to be in recovery together.